जो आज का प्रेजेंटेशन बेसिकली, अच्छा मेरी भाषा थोड़ी हिंदी इंग्लिश चलती रहेगी तो माफ़ करें या एंजॉय करें जो भी। ये प्रेजेंटेशन बहुत अजीब और गरीब हालातों में हुआ है, उसमें नहीं चलेगा। जब हमारे पास में ये सेमिनार की इंफॉर्मेशन आई वो 30 दिसंबर के आसपास की बात थी। 31 दिसंबर को हमको ऐसा लगा था कि इसका एब्स्ट्रैक्ट भेजना है, बहुत कम टाइम में ये 18 तक कैसे आएगा। तो एक बार तो मन में सोचा कि छोड़ो जाने दो, नहीं होगा, नहीं करेंगे, क्योंकि बड़ा सब्जेक्ट है, कॉन्सेप्ट की बात करनी है, कैसे बात करेंगे, कितना बात करेंगे, नहीं पता। पर एक जो कलीग से हमको मालूम पड़ा था, डॉक्टर तमन्ना ने हमको बताया था कि ये चीज़ है, तो उनका एक आग्रह आया कि नहीं करो, होगा। हमने हमारे टीचर से बात किया कि ऐसा ऐसा कॉन्सेप्ट पे बात करना है, क्या करना चाहिए। उन्होंने भी बोला कि हाँ करो, बहुत अच्छा है, पर टाइम बहुत कम है, फिर भी करो। तो अब जब ये दो जगह से मालूम पड़ा कि करना है तो फिर तो करना है। और एब्स्ट्रैक्ट भेजना था, अखिलेश जी के रिमाइंडर्स आ रहे थे, लास्ट दिन था, रात को 4 बजे हमने उसका एब्स्ट्रैक्ट भेजा है। तो जो एब्स्ट्रैक्ट भी भेजा वो भी शायद आधी नींद में बनाया होगा, पता नहीं कैसा था। ये प्रेजेंटेशन है, ये प्रेजेंटेशन के साथ जूझ रहे थे, वीडियो चल रहा है नहीं चल रहा है, कैसा चल रहा है, हमारी काफ़ी सुबह से उसके ऊपर थी। बट ये शायद ऐसा ही होना था, तो ये ऐसा ही होगा। बहुत सारा सुन लिया है 2-2.25 दिनों में। जो सोचा था, जो बोलेंगे शेयर करेंगे, उससे बहुत ज़्यादा बोला गया है, उससे बहुत ज़्यादा शेयर कर दिया गया है, तो मुझे नहीं लगता कि मैं वो रिपीट करूं। तो ये जो नॉलेज का ओशन है, इसके अंदर एक छोटे से 2 बूंद खाली ऐड करूंगा और थोड़ा अलग ढंग से करने की कोशिश करेंगे। शुरू करने के पहले जितने हमारे टीचर्स रहे हैं, और ये एक बहुत जरूरी महसूस करता हूँ कि जो हमारे टीचर्स, सबसे पहले हमारे पेरेंट्स, फॉर्मल टीचर्स, हमारे कलीग्स, दोस्त जिनसे हम बहुत सारा सीखते हैं, और सबसे इम्पोर्टेंट हमारे क्लाइंट्स होते हैं, हमारे पेशेंट्स होते हैं। हमको लगता है कि हम उनके लिए कुछ कर रहे हैं, बट जब हम टेबल के इस साइड बैठे होते हैं, ये हम जानते हैं कि उन्होंने हमारे लिए क्या क्या किया है। हमने जो इतना सारा लाइफ देखा है वो इन्हीं के थ्रू देखा है, इनके बिना हम नहीं देख पाते थे ये सब। और आप सारे लोग, आप लोगों से जो मैं बैठ के यहाँ 2-3 दिन से सीख रहा हूँ, ये आप सब लोगों को समर्पित है। बचपन से दिमाग में ये था कि हीलिंग क्या होती है। ये हीलिंग होती है तो क्या हील करना होता है, कौन हील करता है और कौन हील होता है। एक छोटा सा वीडियो, जर्नी फ्रॉम डिसहार्मनी टू हार्मनी। What is to be healed? That this harmony is to be healed, that this connection. We've been talking about connecting to the source, connecting to oneself, and being connected. That is what we need to reach to. Unawareness, ignorance to awareness. I think conceptually this is what answers my question. Who heals? It is the process that heals. The interaction that happens between the healer and the seeker. The dance that happens between the man and the donkey. It is not only the donkey, it is not only the man, it is not only the music, it is the dance that happens as an interaction of the two. Who gets healed? A part of both. This is as holistic as it can get. Integration, the other word that we are dealing with is integration. What is integration? Integration in philosophies and concepts, integration in methods and practice. We have spoken about universal energy, we have spoken about being connected, we have spoken about being aware, being in harmony, and to be able to see things as they really are. Talking about methods and practice, there are so many of them. What we are looking at, as an example, if I can say, There is something like communication, which is an interaction between two people or one and other, and the medium that we use is language. Communication is the purpose. Language can be so many different languages. It could be verbal, it could be non-verbal. Verbal has a zillion languages that one can learn. There could be many languages, but the main purpose of communication is what integrates. In my practice, I have been able to work with a combination of or integration of homeopathy, psychotherapy, meditation, arts-based therapy, all of this as and when needed, bits and pieces, parts of whatever is needed, as what is relevant to an individual, what would suit an individual, and you mix and match that. So that was another difficulty for me to make this presentation, because I was to focus only on arts-based therapy. So be it. There are so many other ways which I am so interested to learn now, listening to so many people. We'll see how it goes from here. Now, talking about arts, before we go to arts-based therapy, talking about arts. Generally, when we talk only about art. Forget the S. Arts, as in so many different types of. Just to get some, how many people have had any experience of art in their life? Any art form or any play? What is the experience? Can somebody tell me? When you engage with any kind of an art form, what is the experience? What do you?
Art has been anything, right? Not exactly art.
Anything. Play. I included play also, because I mean it is in a way an art.
Through gymnastics, I have had a very good experience.
Could you share your experience while you were in that zone, while you were in that process?
I was in that zone and no more. Of course, I don't do gymnastics anymore. But yes, I was very flexible. So from my school days, I was put into it, and at that time it was Nadia Pramanish or Grafton Wood. The first time there was a 10 on 10 in Montreal Olympics. And that gave me the kind of thing that even I can do it. So I trained myself and I won my championship. So yes, it was a beautiful experience for me to know that I can do so well.
Yeah, so achievement is one thing.
Achievement, and also like being able to perform something which gave me so much of passion. I enjoyed the passion of doing gymnastics for hours together.
Yes. Enjoyment. Anybody else who want to share anything, any other art form? Somebody paints, somebody dances, somebody sings.
I do paint a lot, but that comes in once in a while. The experience that you're asking, the kind of art that I do is like, takes me away from the present actually to dealing with what's on hand. That's one kind of an experience, that it's so focused. Sometimes I forget the environment around, and it's just me and the one which is emerging in that canvas. That's how it has been. It's kind of very meditative for me. It comes, it's very meditative, it's a different realm, and then I don't know what's emerging many times, and then when it emerges, then you are wondering. In retrospective, I could give a lot of meaning to it. So it's basically the kind of a oneness with whatever that I'm doing is my experience. So,
अभी तो मैं अपने बच्चों के साथ प्रैक्टिस करती हूँ, उनको सिखाती हूँ, तो एक्सपीरियंस ऐसा होता है कि पूरे दिन भर की थकान निकल जाती है उनके साथ, ये होता है एक्सपीरियंस.
So basically, जब हमने ये बहुत लोगों से अलग-अलग टाइम पे पूछा है, जो शब्द सामने आते हैं, मजा आता है. ठीक है ना? अच्छा लगता है. वाह, क्या डांस किया, वाह, क्या पेंटिंग है ये, वाह. भले वो हमने मतलब जब मैं सीख रहा था, जब मैं मेरे आर्ट फॉर्म, मेरे आर्टिस्ट में अंदर घुस के कुछ ना कुछ निकालने की कोशिश कर रहा था, तो स्टिक फिगर्स बनते थे जैसे मैडम ने बनाए थे, और वो जब क्योंकि हमने बनाए स्टिक फिगर लगता था क्या कितना अच्छा लग रहा है. तो ये जो अच्छी फीलिंग होती है, a lot of people find it meditative. There is a lot of fulfillment that happens. There is a lot of release that one is able to achieve while you are doing it. So many things cannot be expressed in words. so many things you just don't know. I mean, I feel something, I don't know what. I can't remember, I can get a proper word for this. शब्द नहीं मिल रहे हैं, कैसे बयान करूं नहीं पता. एक गाना था, ओ या वाला गाना सुना है? जो भी मैं कहना चाहूं, बर्बाद करे अल्फाज मेरे. Not able to hear.
Yes, it is.
Hello? Yeah, okay, sorry. So, words have limitation. Verbal language has limitation. But like I think Dr. Chandrasekhar had said on the first day, the language of mind is different. Images, colors, music, sounds, all of these are the natural languages or natural medium of communication. And that is what the realm of art is. And what is art? Natural expression of beauty, harmony, synchrony, expression of joy, expression of perfection. Perfection not as in looking only at symmetry, looking only at it being proper by our conscious construct or cognitive construct, but being as it is. A tree, when a tree grows, there is no method to, at what height should a branch come. ये ब्रांच में सिर्फ 1500 पत्ते होने चाहिए, इसमें 1200 होने चाहिए, ऐसा कुछ नहीं. वो जैसा है वैसा है और वही हमको अच्छा लगता है. हम जब माउंटेन्स को देखते हैं तो हम ये नहीं देखते यार ये छोटा, ये बड़ा, ये इवन नहीं है, इसमें सिमेट्री नहीं है. बट क्योंकि उसमें सिमेट्री नहीं है वो ब्यूटीफुल है. सूरज निकलता है सुबह तो उसमें शेड्स ऑफ ऑरेंज होते हैं, रेड टू ऑरेंज येलो होता है. उसका कोई फॉर्मूला नहीं होता, वो जो है वो है और जैसा है वैसा परफेक्ट है. सो आर्ट इज परफेक्ट इन इट सेल्फ. वी हैव ग्रोन अप विथ ट्राइंग टू डू द आर्ट प्रॉपरली एंड दैट हैज बीन द प्रॉब्लम. अच्छे से बनाओ, ये स्क्वायर के अंदर ड्राइंग करो. आप डांस कर रहे हो तो आपके हाथ ऐसे ही आने चाहिए. ना दैट when you are trying to perform for a certain thing, that kind of perfection is different. But when you are dancing for yourself, when that donkey was dancing, the idea was to cover the distance. Nobody looked at you, उसके steps कहाँ जा रहे हैं, कैसे हो रहे हैं. मजा आ रहा था और वो हंसते हंसते वो लोग पहुंच गए. So it's a natural process of growth. Things happen. You are not making them happen. You are allowing things to happen. You are allowing it to flow. And that is what the experience of art is. Pablo Picasso said, every child is an artist. Every child is an artist. The problem is how to remain one when you grow up. Our education, our conditioning, we've been talking about the inner child. Everybody's been talking about how we develop layers and layers and we forget what we were. Rajni, we all become. So we have it in us because like we have been talking, we are expressions of nature. By default, we are not really making ourselves. This is a part of us, it is within, and arts-based therapy is all about that. There are various use of art forms. Using arts in therapy is basically when we are talking to someone, and the majority of therapy is via talk, via interaction, discussion, insights and all that. We can use a little bit of crayons, a little bit of music, just to set the mood. But the main interaction is happening through another medium. That is not arts-based therapy. That is using art as a small tool or as a catalyst to, just facilitate a certain distance. Art is used in education. When you are teaching somebody the nuances of that art form, and those nuances have to be perfected, or you have to be doing it well. That is learning an art form. That is again not therapy. There is no idea of therapy in that process. And the third thing is arts on clients, where a client is a passive recipient of an art form. You have had like the mantra chanting is something which an expert is doing, and you are receiving the vibrations of it, or energy healing or whatever. So there is a merit in that particular art which has been given to the client, and the client is passively receiving it. Arts-based therapy is a little different from all of these three. It is using the art form as the tool in itself. It is diagnosis by arts, and it is therapy by arts. When we are talking about diagnosing, we are looking at how does an individual use a particular crayon, particular paint, how does he expresses, how the person moves, how are they beating the drum, how are they letting their individuality out using that particular medium. So basically we understand the inner world of that individual, what is going on within. A lot of times people are not able to put it in words. A lot of time they're able to express much more than what can be said. And this expression is ranging from very gross issues of health to subtle issues. A person may not be able to tell you that, I don't have a proper coordination in my hand because I never realized it was supposed to be like this. But when we see somebody drumming on a djembe, and we see that there's a lot of stiffness in the movements, it is not fluid. The person is not able to realize that is not the presenting problem. They are talking about being rigid they're talking about a relationship problem. Like if I can give you an example, currently we are working with a boy around 17 years old with severe depression and a very rare case of anorexia nervosa in a man, severe body image issues. In the history we understand that parents have never got along, being a love marriage between a Jain and a Christian. Mother is a Christian, the father is a Jain. Completely different cultures they come from. Father now says, oh, I didn't know what was wrong with me, and we got into this marriage. The mother is like, this man spoiled my life. They have their own issues, because when we have to work on the boy, we have to work with the parents also. So we had a drumming session with them. Both of them were completely different in their expression. Somebody was trying to do something else, somebody was trying to do something else. And that is where they themselves realized, oh, we have so many different differences within us. And that is how we are able to diagnose in a different way. I'm not saying that's the only way, there are so many different ways, but when we're talking about arts, these are the kinds of expression that we come out with. Tools for therapy. The facilitator is the biggest tool that is used in the therapy. And when we are talking about the qualities of that facilitator, there has to be an ability to go beyond the label, to go beyond the subject-object relationship. That I am doing something for you. Also, you are the client, I am the therapist, I am treating you. No, that doesn't work. The moment there is a potential difference, there's a very different kind of energy flowing. So the first training of the facilitator has to be able to let go. You have to let go of yourself as a knowledgeable therapist, or oh, I am doing something and you follow me. No. It is a process of co-creation. Let us sit down together, let us see what emerges. I am only to guide where we get stuck. That's only the thing that I'm doing. The intent I have in my mind for healing, because I am not the patient, or because I am the facilitator, I can invoke that intent for this session that we are doing. I have unconditional acceptance towards who you are, what you do, no matter whether you have committed a crime, maybe you have killed someone, maybe you have raped someone, whatever that is, I am not going to be judging you as a person. Right now, this is a therapeutic relationship, and I really want you to heal. And so let us create that kind of a field around us. Understanding of impermanence, interconnectedness, and all the various concepts we've talked about. Using the other tool for therapy is the art form itself, the play that we are going to be playing. That's another tool. So choice of a tool could depend upon whom we are working with. I have small children who are so enthusiastic just to play cricket. So our therapy is playing cricket. We have this therapy room, and what we are doing, we are playing cricket. They come to me, 1 hour, we play cricket. But what happens in that game is happening at a very different level. How we are interacting, whether we are competing or we are not competing. Very interestingly, when we play cricket, we play against each other, right? So the initial games we play is, okay, you bowl and I bat, and we have a match and all that. But and so there's a lot of competitiveness. What we may just do is we reverse the roles, that when we are playing, how much ever runs you make, they are mine, and how many ever runs I make, they are yours. So if you make more runs, I win. If I make more runs, you win. So now go bowl. Suddenly the bowling is different. Suddenly the batting is different. I mean, पहले अगर मैं बैटिंग कर रहा हूँ और मैंने मारा तो आप जंप करके कैच करोगे, क्योंकि मैं मेरे रन बना रहा हूँ. बट जब मैं आपके रन बना रहा हूँ तो मैं आपके हाथ में कैच दे दूँ, आप पकड़ के छोड़ दोगे. नहीं छूट गया. Who told them to change? हमने उनको नहीं बोला कि देखो बेटा ऐसा नहीं रन बनाने देना चाहिए. हमने ना सिखाया, हमने ना कोई प्रवचन किया, कुछ नहीं किया. But we just slightly shift the roles. So what? Are we doing role playing through cricket? Are we trying to integrate drama and play? What are we doing? It is just something that is happening on the spot. Spontaneity, intuitiveness. How are we able to get ourselves to that level where we are that spontaneous? क्योंकि क्रिकेट तो हम पेपर पे भी खेल सकते हैं, फुटबॉल पेपर पे खेल सकते हैं. We could dance with brushes. As a child, we would have these pen and pencil, और पेंसिल की फाइटिंग होती थी, और फिर इसने इसको मार दिया और ये उसके ऊपर चढ़ के बैठ गया. What was that? Was that nonsense play? Or there was a story in it? There was a story. And different children have different stories. Different people have different stories. Those stories are their expressions of their inner world. So training of the therapist is something which is a huge focus when we talk about the institute that I have done this from is Creative Learning in Pune. Objective of the training is to be able to develop India-specific art-based therapy models, and this is probably the only model which is incorporating all forms of art forms. Because the West, we have a dedicated play therapy university, we have a dedicated drama therapy, we have dedicated dance therapy, we have a dedicated, but all of that, all of them really work well. But in our setting, integration works better, because it's not only the use of that art form, it's the philosophy that we are working on. And that's where I think what we've been talking about, the integration at the level of philosophy or the oneness and all of that is what really makes the difference. The training is basically a 10-month long action research program where you are learning by doing it. It is a part of theory, but a huge part of it is a practical training program where you work with your clients, you work with a group or an individual, and you make your notes and then present it in the form of a thesis. Theses include like not only a small booklet of your research, but maybe art form of the same thing. So I had to make my own video of the therapy that I have done. Some people do it using painting, some people do it using their own body movements and all of that. So we are basically trying to bring out the creativity because that is so innate to us. The only thing is that we've forgotten and it needs to be coming out. So I think we've talked about this. The idea is not to become skilled artists. The idea is to become healers. Okay. I think it will be good to see another. Go to the second one. So becoming healers. What does it take to become healers? कोई कुछ शेयर करना चाहेगा ये देख के? कुछ आइडिया आया हो, कुछ इंसाइट आया हो, मज़ा तो सबको आया वो तो पता ही है। कुछ भी शेयर, कोई बत्ती जली कुछ?
Consistency, and you're more committed than the client himself sometimes. And then how you communicate that and make that happen together is a challenge.
It's a challenge.
It's a challenge.
पर मजा आता है।
Be
मजा
creative.
तो आता है।
Be creative.
Be creative. So why this video is very very close to me is because I see myself in the position of that fellow who's getting hit by all sides. I've had a boy about 7 years old who was brought for very 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 aggressive behavior. The only thing he knew was tantrums, shouting, hitting and throwing things. That kind of a boy is coming to you with a background of course disturbed parents. So आप क्या कर सकते हो? मैंने बोला ठीक है जो कर सकते हैं करेंगे, ले आओ देखें. On interaction with the child was a huge fan of dinosaurs. और डायनासोर क्या करते हैं? दूसरों को खाते हैं. और क्या करते हैं? मारा मारी करते हैं. और क्या करते हैं? और दूसरा उसका हीरो स्पाइडरमैन. यहाँ से चढ़ के कूदना है और वहाँ से चढ़ के कूदना है और कहीं से भी चढ़ के हमको तुम्हारे ऊपर कूदना है. To the extent, once he just came running, and he jumped onto me and he wanted to swing on my arm. उसने ऐसा मेरे हाथ पे पकड़ के झूल के ऐसा गया और वो तो कूद गया लेकिन मेरा हाथ फिर यहाँ से आगे आने में मुश्किल हो गई. I had dislocated a shoulder. Now everybody was angry on that fellow. कि उसने और ऐसे ऐसे सिमिलिमम मिलते हैं हमको. मैं भी आदित्य, वो भी आदित्य. अब कौन से आदित्य की गलती है, किसको बोलेंगे क्या? तो हमारा स्टाफ उसके ऊपर गुस्सा. उसके साथ जो उसकी नानी आई थी जो उसको लेके आती थी, वो तुमने ये क्या कर दिया क्या. तो ओनली थिंग आई हैड टू टेल देम वाज कि ये उसकी गलती नहीं है. उसको ये ना बोलो ये मैंने उसको करने दिया. आई एम एज मच रिस्पॉन्सिबल एज वॉट ही मे हैव बीन एंड दिस इज जस्ट एन एक्सीडेंट. डोंट वरी. 1.5 महीना था स्लिंग के अंदर, बट डजंट मैटर. द बॉय व्हेन ही केम ही वाज फेलिंग इन हिज एग्जाम्स. Parents were not doing really well. When he went back, we had a very very bad time getting him into a school. The boy had come down from Dubai because the parents were living in Dubai. They had come down for some time. डॉक्टर को भी मिल लेते हैं. जब हमने बोला देखो आप अगर वापस जाने वाले हो का बिहेवियरल डिसऑर्डर हम आपको 4 दिन 1 हफ्ते में नहीं करके हो सकता है. इफ देयर इज अ पॉसिबिलिटी द चाइल्ड कैन स्टे बैक देन वी कैन वर्क ऑन हिम. लोग भी मरते क्या नहीं करते. जैसे कि ठीक है रह लो, नानी लेके आती. वाइल ही वॉज हियर स्कूलिंग का कुछ करना होगा. स्कूल के साथ 2-3 स्कूल में बहुत कोशिश की बट ही वुडंट फिट एनीवेयर क्योंकि वो जहाँ जाए वो तो डायनासोर है और स्पाइडरमैन वाला डायनासोर है. सो इमेजिन अ डायनासोर हु कैन फ्लाई. क्या करेगा वो. तो वो सारी उधम मचाता था, स्कूल से निकल जाता था. 2-3 स्कूल से निकला बट हमारी थेरेपी चल रही थी. It was really nice to see that by the end of therapy, about a year or so, he had come down to playing Lego. And while playing Lego, making houses, making a courtyard, planting trees in them. So we are looking at the transition from the dinosaur era to vegetation and civilization. Now, what has happened? What has changed? And when we are saying this, we understand what I mean to say, or what are the changes happening. This is how communications through metaphors work. When we are talking about a time, see, the world has not actually changed in this period of time from there to here, but the internal world of this individual has gone from the dinosaur era to civilization. And when we use metaphors, this is the power of metaphors, where it is able to go leaps and bounds in terms of understanding, in terms of insight, in terms of depth, which words will not be able to go. I had a couple of more examples, but I think I'm going to skip them. Time ki thodi si gadbadi hai. What I would want to focus on is when we are practicing tangible art form, और when we are practicing an intangible therapy, जिसका कोई अब मापदंड हम बहुत जल्दी ये art forms में नहीं लगा सकते हैं. The process that we follow is to also document these things objectively, also to have parameters by which we are able to measure the outcome. Because when we are talking in the setting of therapy, measuring outcome is very important. We should be able to demonstrate results. They should be statistically measurable, and we should put them to statistical analysis. And for that, when we are working with clients, there is a very, very, I would say, simple system of putting on observations and trying to create qualitative data of observation into quantitative, so that later, as we are able to build up more data, as we are able to churn out more number of cases and studies, it can be subjected to very structured research. So these are, this is an example of how, when we are working with the case, we've not really gone into the details of this case, but if we are talking about the symptom, or I think the issue of participation and confidence, then we would just break it down into these kind of into these parameters and grade them and see what is the progression of that person through. Yeah. So we are taking the observations on different days of therapy, which is generally once a month or so, and we are able to see a progression from being non-participant to being participant in a group activity. This observation is, which we may term it as a symptom, or a symptom which is showing progression towards normalcy. Another way of doing it is, I'm sorry I'm jumping, is we try to put them through a year-on-year or 3-monthly or 6-monthly observation table, so that we are able to structure our observations. We are not just leaving it to subjective experiences कि हाँ हम दोनों के बीच में कुछ हुआ और जो हुआ मज़ा आया, आप ठीक हो गए, हम satisfied हो गए, but इसका कुछ academic documentation नहीं होता है. So in order to make that academic documentation, which is so very important for future training and verification, की does it really work? So such observation tables which give us a comparative study of what has been happening with the person on the same parameters. So like in this case, this is a case of a child with mild autism and mild mental retardation. You are able to see communication improving. So all the elements that come under communication have shown improvement. Hyperactivity, physical behavior, emotionality, and a child with autism is not able to relate emotionally to people, that has shown improvement. We are looking at physical symptoms also, like nocturnal enuresis, like drooling of saliva, recurrent respiratory tract infections and all that. So everything that we can observe in a particular client is put to a qualitative to quantitative kind of a documentation, so that we are able to see the efficacy. These are some of the examples of, this is a body map which is used also as a tool for assessment or tool for seeing what is happening with the child. So before and after therapy, what is the child or the individual when they are trying to map themselves, going from partial to complete, going from distorted to something which has sense. Again, partial to so here we are not really looking at symmetry क्या है, इसका finishing क्या है, आपके strokes कितने अच्छे हैं. That really doesn't matter. What is your view of yourself? Are you viewing yourself partially, or you viewing yourself completely? So, just a one-sided understanding of self, and you're looking at completion. So, how therapy works within, it can also be measured, and I think there are many ways in which we can do this. Over a period of time, collecting such results, there has been a study, I think, conducted in 2014 or 2012, which had analysis of the number of people working with ABT all over India, and 3 areas which were really found to be, it was found to be very, very helpful, was rehabilitation with adults in substance abuse places, children at risk, and children with special needs. I'd be happy to circulate the paper if anybody is interested. Not going into the details right now. Okay, so all kinds of disorders, neurological, developmental disorders, emotional disturbances, behavioral issues, educational difficulties, relationship issues, severe illnesses, psychosis, depression, reactions to terminal illnesses, cancer, heart ailment. There is a whole lot of disturbance that they go through other than the ailment. This is, we can really relieve them. I'm not saying we can cure cancer, but the disturbance that the individual goes through because of cancer or because of any other block that they are having internally, that can be helped. And if cancer gets affected, all the well and good. Preventive health is something that there's a huge potential that this can have in preventive health. Just going through a small video of that, the various number of clients, the different kinds of clients we can work with, the different issues we can work with. When we are using it as a preventive method, we would like to call it planasium. When we have gymnasium for the body, we have planasium for the mind. खेलते खेलते मजा आता है उसी से. Maybe I'm not focused.
Yeah, I'm actually a very colorful person. Like my black is very colorful as flower. There's a bad point in me or anger.
This is my world. The black represents everything bad and negative. The green represents a lot of positive. And essentially, my biggest strength, what I like about myself, is that I'm a very positive thinker. I'm a go-getter.
Don't say anything. You just say the same 1 minute. Okay, 1 minute. Arey, my child, you will hurt it. Move. Oh God, what did I do?
एक घंटा बाद में टाइम देखा उसके
तो मैसेज करें
करना पड़ता है
तो मैंने काम की बात कह दी थी
बात तो एक बजे
12 बजे देना चाहिए
So though this comes to the end of my presentation, but like they say, picture abhi baki hai mere dost. I'm going to leave you with just one last video. If the audience is interested, we could engage in some discussion about it, or maybe it's